Your organization recently published an interesting survey on how COVID-19 has shifted consumer attitudes to healthcare. Would you care to discuss one or two of the top findings? And was there anything there that surprised you?
Sure, I'd love to chat about it. This was a national survey of adults 18 and over across the entire country, a good demographic mix, if you will, to really represent the nation. And we were most interested in the way in which the COVID-19 pandemic has altered patients' views about going to a doctor's office or hospital, how they are interested in receiving healthcare services now and in the future. And in many respects, the data validated what we've been hearing anecdotally, but it's always so powerful to get the data. And so a very sizable 72% of the respondents said that the pandemic had dramatically changed their use of healthcare services over the past few months. And what we saw consistently was that through the early months of the crisis and for at least the next 3 to 6 months, high levels of anxiety about going to a doctor's office, a hospital, an urgent care clinic, really any of those in-person sites for elective procedures, diagnostic procedures, tests, etc. We heard from, in particular, those individuals who said they had chronic conditions, and senior citizens in our survey had even higher levels of reluctance to return to in-person facilities for probably at least the next 6 months. So as you can imagine, that has very important implications for the health sector and potentially large implications for individuals' health. Now, the good news, flip side of that, is that we saw a remarkable tripling of use of telehealth or virtual care in that time period. And even more impressive was that the satisfaction rate, customer satisfaction with telehealth was just terrific. Of those that had a telehealth experience, whether it was phone or internet, in that short time period, 89% said they were satisfied or highly satisfied with the experience. And the individuals in the survey that reported using a smartphone app to manage an existing medical condition, might think in terms of diabetes, sleep problems, heart conditions, 97% of those individuals described that as valuable or very valuable.
We hope you enjoyed this podcast. Subscribe to our podcast series at www.thebigunlock.com and write to us at info@thebigunlock.com.